Hello again. I'm Dr. Wendy, aka Dr. Every Woman, and we're taking off the white coat. I want to talk quickly about abnormal bleeding, especially in people who are over the age of 40. So if you're over the age of 40, or especially over the age of 45, and you're bleeding irregularly, you start, you stop, you're spotting in between cycles, sometimes it's perimenopause. Look, I'm 44, so flashes do be flashing. But sometimes it's perimenopause, sometimes it's not. So make sure that you are talking to your provider about how you can be sure that you're safe. Do you need hormone testing to see if it's perimenopause? Do you need an ultrasound to make sure your uterine lining looks normal, that you don't have fibroids or polyps or any abnormal growth within the uterus? Because uterine cancer is rare, but it does happen and it can manifest as irregular bleeding. So sometimes people need something called an endometrial biopsy or even a hysteroscopy, a scope to look inside of the uterus to make sure that they're safe. So abnormal bleeding over the age of 40 is sometimes managed a little bit different than abnormal bleeding under the age of 40. I want to talk more about abnormal bleeding under the age of 40 in a different video. But I also want to just really drive home the point that if you have stopped having periods for 12 months, okay, that means you're menopausal. Real quick definitions. Premenopausal means you're not even in the space. You ain't even, peri hasn't entered the chat yet, okay? Perimenopause is like that anywhere from 1 to 7 years where your hormones are starting to make changes and you are transitioning into your menopausal years. You are not there yet. You're still having periods. They may be sporadic. You may be having hot flashes, night sweats, brain fog, weight changes. That is peri, okay? Perimenopause is the transition period. Menopause is also known as postmenopause, where you have hit the mark, okay? The mark is 12 months with no period. The mark is 12 months with no period. You are then menopausal. You can also say, I am postmenopausal. I don't care what you say. You in the gang now, okay? You in the club, you menopausal, okay? If then you bleed again, please tell somebody. If then you bleed again, please tell somebody, because now I want to make sure that you're not bleeding because you have a cancer. Cancer is not the most common cause for bleeding, but it is the most dangerous. So it may warrant an ultrasound, it may be even an endometrial biopsy to make sure that your uterine lining is safe. The most common reason why a person will bleed after menopause is that they have atrophy, which means that the cells, because they have less estrogen in them, are thinner, they're more what they call friable, they're more fragile, they're more likely to break, and that can cause bleeding. So atrophy as a source or as a reason for bleeding is not great, but it's not dangerous. And we can talk later about hormone replacement therapy. I don't want to get into that today. That's a lot. It's a big conversation. But I want to just make sure that you know how to remain safe. So if you bleed and you are menopausal, or you're postmenopausal, however you want to determine how you talk about it, this needs to be evaluated. And if you're bleeding irregularly and you're perimenopausal, this may also need to be evaluated. So please don't be silent. If you see your granny busting out pads and liners, hold up, okay? Hold the phone. Call somebody, okay? Because it's not normal. And I want her to be safe. And I want you to be safe. So thanks as always for joining, for rocking with me. And please, as always, this is your friendly local gynecologist.